Hey everybody, it's Jasmine. Welcome back. This is going to be part 2 of my ACL recovery series. So if you want to see how I tore my ACL, click somewhere up here. Now I have some notes, and this is going to be surgery day and the week after. So it's kind of like 2 weeks put into one video. This video may be a little longer than I would like to post, but it's gonna work. Sorry I look a little rough. I had therapy a little earlier, so I'm going to try to crank this video out and then take a shower. Directions for the day before. I'm sorry if I'm looking down, I'm reading my notes. So no shaving for 48 hours. Don't eat past midnight the day before. Bath the night before with Dial. Scrub really well, and they tell you don't put anything else on your body like lotion or anything. So get out the shower, dry yourself, and just be ashy. And in the morning you're going to take the bath the same way. So there's 2 baths to make sure you know that it's an antibacterial soap. So that was before, and they tell you to bring your brace. I'll insert the brace over here again. We saw it in the last video. Day of surgery, the day before surgery, they called me at like 5:30 and told me to show up about an hour earlier. So I was asked to show up at 6:30 instead of 7:30. Surgery would be for 7:30 or 7, something. I don't remember exactly. But so the day of surgery, I left the house at 6. I checked in and everything at it's a outpatient facility. Check in and went to sit. Somebody called me off to the side and they spoke with me about billing. So we handled all my billing and all the papers I needed to sign, and spoke with her. We were working for like 30 minutes. And then when we were done, I went and sat in the waiting room for a couple more minutes, and then they called my name and I went back. So when I went back, it's not like giving birth and everybody has their own room. It's, when I saw it, I thought of MASH, the TV show, old. It's just a whole bunch of beds lined up. There's partitions, 3 partitions around you. Each person, when I walked in, I was the last bed. So when somebody walks in, I was the first one to the left. The nurse told me, put your stuff here, go pee, or go use the restroom, pee in a cup. You have to do the pregnancy test. We have to make sure you're not pregnant. When you come back, put on the gown, put on the circulation sock thing. It's a white sock on my opposite leg to, make sure I don't get any blood clots. I also forgot to mention that the day before, they had a prescription ready for me, so I went and picked that up on Thursday. I changed, I put all my stuff, my phone, everything was in a backpack I brought. I got in the bed, put on socks. They gave me warm covers, and I just kind of got comfortable because I figured I was going to be there for a couple hours. During that time, I probably met with 3 to 4 doctors and nurses. Every time they'd come to my partition, they'd ask me like 4 or 5 of the same questions. And, they tell you each time, sorry, we have to ask you the same thing. We just want to make sure everything's right. We want to make sure they just want to make sure. So they ask you like your name, what you're getting done, what side, what part, your birthday, stuff like that. Then the anesthesiologist came. He explained to me what the nerve block was and what it does. And while he was doing that, I was getting an IV. And I just had the IV input, and they gave me some O2 just to they said it would kind of relax me a little bit. So then when they came and he asked me about the nerve block, I agreed to it. So he said, okay, he would come back and he would give me some more so I could relax a little bit more, give me the nerve block. So I think they cut on whatever they give you to make you fall asleep. I remember him giving me the nerve block. I don't remember feeling it at all at that time though. Like, I didn't feel the pressure, the poke, or anything. So I vaguely remember it. I think I remember, but I'm not too sure. And then that was the last thing I remember. I couldn't take my watch or anything or any jewelry, so I couldn't tell you how long I was under or how long I was in the back. But I remember waking up. I woke up and I looked around. And I realized I wasn't in the same spot I was earlier because I was further down. I was probably one of the last beds towards the back now. Immediately fell back to sleep. I don't know how much longer I was asleep, but I did wake up And when I woke up, a nurse was coming in. Crazy thing is, I never saw my doctor. I couldn't even tell you if he was the one that performed my surgery. I mean, I'm sure he was, but I couldn't tell you. Nurse came in, took the IV out, I don't remember. The first thing I remember is he asked me if I wanted something to drink, so I got apple juice, and I was like, oh, thank God, because I'm hungry. So I chugged the apple juice, and then I started feeling very nauseous. So I asked if I could have a bag to throw up in because I was getting ready to leave. So he said, sure. So as he left to go get me a bag to throw up in, I kind of just spit up. I didn't really throw up yet. I spit up in my cup that I originally drank the juice out of. And I was like, ugh. I was real groggy and real just bleh. I remember the doctor or the nurse came in. He kind of said, well, here are your clothes. Do you need help getting dressed? I put on my own shirt, and I had him help me with my shorts, and I didn't put my socks back on. I put my shoes on, and then he brought a wheelchair. I kind of lifted myself out of the bed by myself, and he held the wheelchair steady, and I sat down. I wasn't in any pain. I couldn't really, I tried to step on my leg once I sat down just to see, and it was completely numb. Like when your leg's asleep and you try to stand up, it's like, blah, blah, blah. I had a noodle leg, for real. So there was that. And as he's wheeling me off, I asked him, can you please go slow because I'm really nauseous. I felt like we were speed racing in that wheelchair. So he took me to, there's a waiting room inside where they do inside the patient's room. It's towards the back, and it's a back entrance where they have them drive up the car. So he took me to my boyfriend. He gave him my stuff, and apparently when my boyfriend came in, the doctor gave him like a rundown of what I need to do and stuff. So luckily my boyfriend recorded it. I guess I was there because my boyfriend asked me, you didn't hear the doctor say that? And I was like, what? I don't even remember the doctor ever coming to me. Like, couldn't tell you what it looked like that day. So luckily he recorded it. So we had that to listen to when we got home. We were going home. He picked me up something to eat. I threw up before I got in the car. I threw up all that apple juice. I threw that up, and then I spit up again. I had that bag, so I didn't throw up in my car, thank God. But we're driving home, and I'm in and out of sleep, nauseous. I don't feel good. So I just had like Chick-fil-A chicken noodle soup. I got some fruit, and I got a Sprite. I never drink Sprite, ever. So got home, and I had my medicine at home, and I was like, I'm gonna wait to take it. I remember I said I was gonna wait to take it. Funny thing is, got home, I hopped from the car through the garage to inside the house. Then I saw my son's little square scooter. I sat on that, and I wheeled myself over to the couch, got back up, and laid on the couch. I didn't move the rest of the day unless I had to use the restroom, but I went once or twice. I was drinking a lot of water those first few days. So, but pretty much I was in and out of sleep. Like, you'd be talking to me and I'd be asleep. And I'd be asleep for an hour, wake up for 10, 15 minutes, sleep for 2 hours, wake up for 30 minutes. Like, that was all day that first day. Friday, I also had some joint pain that night. But again, I still like some joint pain where I think they gave me the nerve block. I had that joint pain in my hip right here. Is that my hip? Yeah, I guess so. My hip. So to start, week 1 was Saturday, basically. That morning I woke up and I had like a real hot sensation on the front of my leg, like my shin area. I slept through the night, didn't wake up to my alarms, so I didn't keep my medicine schedule. And I woke up that morning and I took my medicine. I wasn't in pain, but I wanted to make sure I didn't. I didn't want to make sure pain wasn't coming, basically. Again, pain on the front of my leg. That morning, it was warm sensation, and then it was like a bone pain. So it was like warm sensation where the bandages were, and then like I guess where they drilled, that bone like was hot and it just hurt. The bones hurt. Later that evening, my nerve block was probably all gone. Like I could feel my foot and I could put pressure on it. It was always bearable pain. Then Sunday, I no longer had the warm pain, I guess you could say. Now the pain was where my incisions were. Saturday night, I had crutches. I didn't have crutches until Saturday night. So for a whole day, I went without crutches. Well, thank God I got crutches, because for the next week or two, they helped me tremendously. I was able to put some weight on my leg. My leg was no longer numb. I had no real pain. I was just kind of tired of laying down, and, you know, I had my leg elevated. I wasn't icing yet. I was taking 3 medicines. I was taking 3 or 4. Children's Tylenol, ibuprofen, the pain pills they prescribed, and a stool softener, 4. So that night I had pain on the inside front of my knee and the back of my knee, and I was just kind of ready to take all those bandages off. I was wrapped up again. Monday was my first post-op appointment. So they took an x-ray. They took all the bandages off my leg, well, the ACE wrap bandages, and they put actual band-aids over my staples. I was told to ice 3 times a day and continue taking my medicine. That day I went to the store to go grocery shopping. I rode a scooter around, of course, and then I went out to eat with my mom. That night, I felt like my brace was just hurting so bad. It was so uncomfortable. And after this, I was still wearing a brace all day, and my brace was still locked out after my first doctor's appointment. Well, when I got home, I noticed the bottom of my leg was like huge. I guess from being compressed so much, and then finally taking the compression off, my leg was like, you know what I'm saying? So my leg kind of swelled up a lot. So I iced that night multiple times, my whole leg. I would ice up high and then continue going down low. And I was icing, I was taking the brace off to ice. That night I couldn't sleep through the night. It was just really uncomfortable because of the swelling and the pain. Tuesday, which was day 4, my leg was still kind of swollen. It was my whole leg was sore in the morning. And then I took another round of pain medicines. Wednesday of week 1, I started physical therapy. When I first went, I had a physical therapy student who was completing PT school. He's supposed to be graduating in May. So they do like a assessment of what you can do and what hurts, and, you know, they take your degrees and everything. And so I did a few stretches, and I did very, very, very basic exercises, just because I was Friday, Saturday, Sunday, Monday, Tuesday. I was 4 days from surgery. So just, you know, and I was bending my leg because I was trying to. Sorry, it's a bug. So I was able to bend my knee a little bit, and I kind of did a few exercises. Went to surgery. Was a little stiff after. I made sure I iced after. I did take some pain medicine before, because of some videos I saw, people were like screaming and crying their first day of therapy. What was I missing? I don't know. Maybe I have a high pain tolerance. But that was one of the last days I took a pain pill. That was probably the last day I took. No. I took one the next day, Thursday, because that was my second day that week. And then that was the last day. So, no real extra swelling. It was still kind of swollen, so I continued to ice again. I took a sponge bath that night, whatever. I had my mom bring me a bathing bench, I guess you could call it, to sit in the tub. That helped me tremendously, because it allowed me to sit in the tub, and the chair was kind of level with the tub, so I could prop my leg up. It helped tremendously. I wouldn't have been able to, like, somebody would have had to bathe me otherwise. Because I was trying to be very independent when my son wasn't around. I needed help with my son. I really didn't need too much help, except if somebody drove me around and cooked for me. But, like, I could get around and go to the restroom. I could put on my own clothes. You know, I could do for myself. I just couldn't cook for myself, and I couldn't drive. So, that's where I needed help. And then, so I went Thursday for day 2. I went Thursday for day 2 of therapy. I went Friday for day 2. I met my therapist. She's amazing. Like, she's so encouraging, but she's strict, and I've made so much progress. And she's like, compared to some other what I've heard from some other people, she's good. So you know, she was impressed by what I was doing, and so we inserted a few more exercises. A lot of it was stretching stuff because they just wanted to get that flexion and range of motion back before we started to strengthen. The only strengthening we were doing was trying to get my hamstrings and my quads, especially my quads, to start firing again, because they kind of weren't. So we had to say, hey, wake up, come on, do your job. So that's pretty much week 1. It wasn't as rough for me as some of the other videos I've seen for people. I think that day the roughest for me was probably the day of surgery, and that's just because I was throwing up, and I've only watched one video where she said she threw up and she was nauseous, and I didn't expect that because, again, I had a C-section, and I didn't throw up from the anesthesia, from being put, well, I wasn't put to sleep, but I didn't throw up then, so I didn't expect to throw up again. And then the other hardest day was probably the day I got my ACE bandage taken off, just because my leg swelled up so much and I was so uncomfortable because of the swelling. So I tried so hard to get that swelling down, and eventually, I mean, it went down. But sorry this video is so long. I definitely am condensing it, but stay tuned for what week 2's like. Bye. Thanks for watching. Don't forget, like, comment, subscribe. Bye.